Thank you. Yeah, I think, I thought about combining these two presentations into one, but I didn't know how well that was going to be received. So we should be able to kind of skip through a lot of these slides because there are a lot of similarities because they're from the same course. So this talk is going to be focused on the dilation module from the same Flex Endo course. Again, I have no disclosures. Similar background, and again, we here want to present this modular curriculum on endoscopic dilation, or more specifically, balloon dilation. We use a similar into-the-fire approach where participants are asked to perform the simulated task first based on these different learning theories. So specifically to the dilation module, we used, again, a similar model, actually, ex vivo porcine model to simulate esophageal strictures. And the task we asked the participant to perform is through the scope balloon dilation, although we also provided an option for a bougie dilation. In terms of assessment, we used a similar knowledge-based written test, the confidence surveys, as well as the OSATs and gauges for the technical skill assessment. Similarly, for our initial first courses, we used modified OSATs, but for the most latest course, we actually used modified gauges. And again, this is a previously validated form, and we added specific items, such as the balloon dilation of the stricture, as well as safe withdrawal, and also appropriate balloon placement. We had the same cohort, 28 practicing surgeons with varying experiences. And looking at the earlier courses using modified OSATs, again, we saw significant improvement in the written test and confidence survey scores, as well as every single individual item from the modified OSATs. And looking at the modified gauges for endoscopic balloon dilation, we saw significant improvement in the balloon dilation total score, the equipment setup, and appropriate balloon placement. There was a trend towards significance in the balloon dilation of stricture, but not quite there. And similarly, we combined this item scope navigation and keep clear endoscopic field into a single item on the final version of the assessment form, and expanded equipment setup to include choosing as well as setting up the devices. And here, interestingly, we could not calculate the Cronbach's alpha for the post-test in this situation because in both evaluation forms, all participants scored a perfect score of 5 in each item, making it impossible to calculate the Cronbach's alpha. But here you see the modified gauges actually scored a little less than modified OSATs, which sort of makes sense if you look at evaluation, right? OSATs kind of focuses on general skills for every single item versus our specific gauges assessment form has specific, it kind of focuses on the first couple items kind of evaluating the specific or actually general endoscopic skills, while the remainder are focused on specific skills related to the balloon dilation. And similar limitations, and I'll just repeat the conclusion here. We found that our modular simulation curriculum is effective in teaching endoscopic balloon dilation, and this into-the-fire approach is extremely helpful to teach practicing providers who come from various different backgrounds. And the goal of these, modular curriculum on Flex Endo is to kind of implement this and publish them so that different institutions can easily adopt these modules to add to their existing curriculum. Thank you.